Okay, welcome. So we are live, another day, another live. You know how this shit goes by now. See, nothing really changes on weekends versus weekdays. It's all the same. All these same days run together, at least for myself. So welcome. Good to see you. Good to enter in. It's about 5 p.m., so we're having our regular meal for the day. And I think my meal schedule has shifted a little bit because I've been staying up later and waking up later. Usually I like to eat about 5 hours after waking up, give or take. About 5 or so hours. So that is that time right now for me. So so if you, it looks like we got some people coming in, so welcome. Somebody asked, Jessica says, why is it hard to live with family? It depends on your family. I don't think it's hard to live with family, but it depends on whether your family is supportive or not supportive. So if you have a very supportive, understanding, nurturing family, as I've been fortunate to have, then it's easier. But if it's not, then it's harder. So, you have to decide whether it's a net gain or net negative to live with family. And if you have problems living with family, then that's where you have to set boundaries if you have to. Do you know how to naturally help hypothyroidism or Hashimoto's? So one of the things you can do is you have to decrease what's called inflammation, because a lot of people have inflammation. And hypothyroidism is an autoimmune condition, especially Hashimoto's. So if you can decrease the amount of autoimmune inflammatory activity, you can help it. And so one of the ways to do that is by I'm blanking right now. Like omega-3s, for example. Like that's a great way to decrease inflammatory activity. Yeah, good afternoon. Yep, hope you're doing well. Yes, I am doing well, yes. Hope you are doing well, too. It is a beautiful Saturday afternoon, so we're about to get our regular lunch ready. Let's see if there's any OGs here, because the OGs will know what we're about to have. What's on your glasses? So these are dry eye glasses, and basically, I think it might be out of olive oil. Yeah, so these are dry eye glasses, and they protect me from dry eyes. Sorry, they protect me from the moisture or from like the wind in the air to keep my eyes good. I am on bipolar and on lithium. Can this affect my thyroid? Yeah, lithium can cause thyroid destruction long term. Some people can get hypothyroid because it can kill their thyroid. So that's where taking lithium levels regularly is definitely very important. Let me guess, fish and broccoli. Well, aren't you a clairvoyant psychic? So, yeah. Now let's see if we'll be able to maintain this or not. Okay. How many days do you work? See, for me it's different. I work and I don't work. So I work when I need to, and I don't work when I don't need to. So that's the pros and cons of living this online life. I'm meeting with my chicken's somewhat. I left it to thaw for like 24 hours for I guess 15 hours, and it's somewhat thawed but not fully. That is unfortunate, but we gotta do what we gotta do. Who do you live with? So I do have a roommate, yes, and we do cohabitate, yes. What is your opinions about aripiprazole on paranoid disorder? Yeah, you can use aripiprazole for paranoid. Basically any kind of psychosis. In fact, I had a patient who had delusions, and I treated him with Abilify. He had delusions that he was being poisoned, and so I was able to help him get better through Abilify, where he had the delusions went away. I get my broccoli from Costco. I just get flavored broccoli, or not flavored broccoli, but yeah, I get broccoli from Costco. Akathisia, what to do about it? So you can use propranolol to help with that. You can also decrease the dose of whatever you're taking too. That can also help with akathisia. It be looking crisp. Yeah. Also, so who here is a provider and who's a patient? So here's, we got 128 people here. So tap 1 if you're a provider and what kind of provider, and tap 2 if you're a patient. All right, I'm just cutting up open this fish here. Okay, so that's the oven. That's telling me the oven is ready. New York, okay. Yeah, so type 1 if you're a provider and what kind of provider, and then 2 if you're a patient. So are you an NP or a PA or a psychologist or an MD or whatever? Okay, at least we'll get our 2 pieces out here. And I'm actually gonna follow that suggestion that someone gave about thawing it out, or about covering it with aluminum foil. I'm going to follow that. What do you think about sleep paralysis, PMHNP? Nice, we got a good mix. So it looks like we're at 845 likes. Definitely like this too, so we can spread it for more people. Eating the same thing every day. Yep, I eat the same thing every single day. And yeah, I really like it because it really helps me meet my calorie goals and my protein goals. So it makes it super easy for me to stay consistent. Because see, the problem that most people have is they're unable to be consistent with their diets. And that's why most people can never maintain their weight or lose weight or whatever, because they don't have that consistency. So now let's get out all of our seasonings: garlic, salt, pepper, lemon pepper, Himalayan salt. Get the whole mix shebang here. Yes, community mental health, PMHNP. Nice, welcome. What is your go-to med for OCD? So my go-to med for OCD is Luvox, fluvoxamine. That's what I like to start with. If fluvoxamine doesn't work, then I will go to I could use any other SSRI just depending on the patient. For example, I've used Lexapro before. I've used Zoloft, sertraline, Prozac. But then if 2 SSRIs don't work, that's when I'll lean more towards clomipramine. So that'll be my go-to, my third go-to. Actually, maybe I'll put, instead of olive oil, yeah, olive oil should be good. Yeah, I'll put a little bit on to help the seasoning stick on. I have insomnia now. That's not good. I actually just, for my NP coaching program, I actually just made a module on how my providers can treat insomnia, how to address it, how to treat it. So if you're part of the program, definitely check that out. I'm going to be uploading it later today. All the different ways to understand sleep disorders, how to treat insomnia, all of that, all of the above. So yeah, definitely stay tuned for that. Do you use real butter? I do not. No, I use olive oil. But yeah. Now we're going to be trying the lemon pepper, see how well that will stick. And then also salt and pepper. How do I take mirtazapine to connect sleep anxiety if you're working night shifts? You basically just take it at the end of your shift. Take mirtazapine when you're trying to go to sleep. That's the best time to take mirtazapine. What you cooking? Stay tuned, and you shall find out. perfect. Now at least I'll flip it over that way. Is it normal to wait 6 weeks for a legal psychiatric report? Yeah, those reports, the legal stuff takes a long time. What do you do on days off? I don't have days off. Every day's a work day. Every day is a work day and every day is not a work day. So I work entirely from home because I live the, psychiatrist influencer life now. And pretty much if I want to work, I'll work. But if I don't want to work, I don't work. So, today I did some work. I recorded lectures for my NP coaching program. So I did that. But then tomorrow I won't be doing stuff. I'll be doing more social activities. Monday, I'm going to be working. But then if I want to take off, for example, I can do that. So that's the flexibility that working remote, working online gives. You can kind of work when you want and work and not work when you don't. Wednesdays are my clinical days, so that's where I see all of my patients. And Mondays and Tuesdays are a lot of my big coaching days. So that's where I do my weekly coaching call with my NP students every week. So we do our weekly coaching call on Mondays. So that's where we go over all the cases they have, any kind of clinical questions, any kind of explanation questions. So I'll do that on Mondays. And then the other days I either do social media stuff or I work on my program. Or go live and stuff. So kind of a mix. And of course always eating salmon and chicken and broccoli. That's usually the routine. Honestly, I don't know about you, but I love having a routine because it just allows me to just feel and stay so consistent to things. Okay, awesome. We have a good mix here. 15, nice. We got 126 people in here, so we are vibing. Awesome. Welcome in to the channel. Have you found citalopram or sertraline helps more? They're both good. They're both. I would definitely go sertraline rather than citalopram. Citalopram just has some health risks, some cardiac risks at high doses. So I'd probably start with the sertraline first. That's pretty standard. Is inpatient psych dangerous? No, it's not dangerous. Also, oh wait. I forgot. I was supposed to cover the chicken and the salmon with stuff. My psychiatrist gave me good shit. Awesome. I'm glad it's good shit for you. There's validoxin. I don't know what validoxin is. You have to use the generic. Brother, I sub, so you see my question. Nice, thank you for the sub. Yeah, say your question. Yeah, so remember, if you sub, then your questions will stand out above everyone else's. So definitely look at subbing if you want me to prioritize your questions. They're just streaming in super crazy right now, so I just need to be a little bit more careful. I can't see everything right now. She gave me C4 and C2. Nice. Igomelatine. We don't really use that in America, so it's hard to say. Oh shit! I didn't need to do it fully. I just need to cut it up. Whatever. Do you believe in Tonkat Ali? Yeah, I've seen some testosterone supplements which use it for testosterone boosting. I like to go towards natural options to boost testosterone personally. Yeah, so say 1 if you're a provider, say 2 if you're a patient, or just a general everyday person, because we have a lot of people coming in here, and I think the algorithm changes a lot. Seroquel makes me gain weight, and it causes more problems than good. Yeah, then you have to discuss it. Remember, don't discuss it with me. Discuss it with these problems with your actual provider, because I can't make med changes for you. I can just give thoughts based on the patients I've seen, but you are an individual and you have your own stuff going on. So 1, nurse practitioner, hey Paul, good to see you. Okay, let me set the timer here too. Probably 19 minutes should be good. It's like kind of thawed, but kind of not. So that should be good, and then I'll let it cook for a little bit longer. One, nice, one. Okay. Okay, just putting the aluminum foil back. Yeah, so if you're a provider, definitely let me know what your questions are too. I'm curious to hear like questions about jobs or NP coaching or like clinical cases, that kind of stuff. So just curious what kind of questions you have. What can you use for benzo withdrawals? So typically you would use, you can use Librium. You can use Librium. You can use, you use more benzos. You use long-lasting benzos to help treat benzo withdrawals. You can use barbiturates as well too, because they all hit the same receptor. Benzo withdrawals are definitely a bitch. So, always remember that if you're tapering a benzo, you have to taper it slowly. You can't just like get the patient off of benzo super quick. You have to do it slow and steady. And so I've worked with some patients to help them taper off benzos as well. So, if you're a patient, or if you're a patient, for example, and you want to work together, best way to do that is in my just send me a message, or send me a message if you are a provider and you really want to learn, especially a PMHNP, and you want to learn in-depth psychiatry. I just finished an entire module on sleep and sleep disorders, so I'm going to be uploading and sharing that later today. What is PMHNP? So it stands for Psychiatric Nurse Practitioner. That's what a PMHNP is. So it is it's a nurse practitioner who decides to pursue training in psychiatry. So I do coaching for NPs, where basically as a psychiatrist, I teach in-depth psychiatry to different NPs. And we have 148 people who joined our program in the last 2-3 months. So definitely been growing, because a lot of people, they find that their education was not that good, and they find they struggle a lot with patients, like specific tough patients, and they get overwhelmed with a lot of tough patient cases, or they just get given a lot of tough patients. So that's why I create a coaching program to help NPs with that. So if that interests you, definitely check it out in our bio as well. You don't want to be feeling unconfident. You don't want to be feeling like people are judging you, because I think a lot of providers do judge NPs. So I want you to feel as confident as you can and not feel imposter syndrome. I'm a PHNP. Is your program a course? It's both it's a course and it's a coaching. So there's a course component where any psychiatric concept you want to look up, any medications, any treatments, any supplements, all that's covered in the course. How to treat bipolar, schizophrenia, depression, my treatment algorithms as a psychiatrist for all that stuff. So all that's recorded so you can view it whenever. But what's really helpful is that we also do live calls. So we do live coaching calls every single week. And so that's where you can ask me real-time clinical questions with your patients. Right? Because ultimately, the reason you're learning all this psychiatric info is to help out your patients. And we're all going to have tough patients. And sometimes, you're struggling with the patient and you want to be able to discuss it. So that's the most important thing. So yeah, if that interests you, check it out in my bio or send me a message, right? If you really want to level up your psych skills. Are there any modules on substance use? Yes, of course. So I literally just recorded a module today on motivational interviewing. How to walk a patient through the various stages of change so they can get better. Because the way that you help a patient get through a substance problem is you have to encourage them to do it. And you have to encourage their motivation to get through it. And the way you encourage their motivation to get through it is through motivational interviewing. So if you understand how to do that, you can move a patient along the various stages of change. So where they go from not wanting to get better to actually wanting to improve their life. But yeah, then also modules on Suboxone and buprenorphine, naltrexone, disulfiram, acamprosate, etc., etc. So yes, definitely a lot of substance teaching as well too. So I would encourage you, definitely check that out, especially if you're a PMHNP and you want to learn in-depth psychiatry. Okay, we'll put this in here. I think we got about 15 or so minutes. Yeah, also double tap if you're liking this. Double tap if you are liking this live too. We're at 2,600 likes. Let's see if we can get to 3,000. Is Wellbutrin a good choice for anxiety? No, I wouldn't use it for anxiety. Wellbutrin is too stimulating to be used for anxiety.
Yeah, I mean, I would do like 10 days, I guess.
Okay. I've been weaned off of paroxetine 40 milligrams. Will have horrible withdrawal symptoms. Maybe, maybe not. There's no guarantee of withdrawal symptoms. You can have it, you can't. It literally just depends on the patient. So always remember that. So especially if you're a provider, withdrawal and stuff is so subjective. Like I've had patients come off Effexor without any problems, and then others who've had a lot of problems. Latuda for bipolar depression. Yeah, so I prescribe Latuda frequently for bipolar depression. One of the advantages Latuda has over something like Seroquel is that weight gain is not as common. Do you consider depression a disorder or a symptom? Both. So I think we use it as a disorder for classification purposes, but in reality I think it's a symptom for brain health, that some kind of brain health problem that's happening. Because there's both a neurobiological basis for depression as well as a psychological and sociological basis for depression, the biopsychosocial model. What do you think about Haldol and risperidone together? I wouldn't stack two antipsychotics like that unless it's super severe. Brain health or trauma? Both, yeah, both. I mean, trauma can cause it. Brain health, like, if you're not eating healthy, you're not sleeping well, that can result in a lot of depressive symptoms as well. What's your opinion on FMT? I don't know what FMT is. How can genetic disorders affect mental health? I mean, if you have any kind of genetic problems, a lot of mental illnesses are genetic. We know that bipolar is hereditary, schizophrenia is hereditary, a lot of trauma gets passed down through our genes, like ancestral trauma, so both. Cookie baby, TTS, what do you think about GeneSight testing? So that's so funny. I actually had a discussion on GeneSight testing in our coaching program as well, where I shared how to read it, how to interpret it, and my opinion. So my opinion is that it is, I think it's overrated. So I think a lot of people, the problem with GeneSight is that patients will come in and they'll say, oh yeah, this med's in the green and this is good, or this is in the red and that's bad, which is not the case. All GeneSight testing does is it looks at metabolism of different medications and whether someone's a slow metabolizer or a fast metabolizer. So just because you're a slow metabolizer, you may be more likely to have side effects, but you can compensate for that by reducing the dose. And if you're a fast metabolizer, you may be less likely to have side effects, but that's because you're just breaking it down faster. Or you may be less likely to have an efficacy, so you might need a higher dose. But patients will interpret it and be like, red, I can't take a med in the red. oh, but green is good, but the same meds are always in the green because they don't test for the specific things that break those down, aka Wellbutrin, Prestige. So if you're a provider, let's like look at this. Next time you have a gene site, like guarantee you Prestige and desvenlafaxine and Wellbutrin, and then maybe Fetzima, those will be on the green, because it literally is just a marketing thing, and people have bought in for it so much. So definitely important to acknowledge the limitations. If you're a provider, acknowledge the limitations of gene site testing. So yeah, if you like this, if you're getting value, definitely double tap this. We're at 2,900. Let's see if we can get to 3,500K likes. Yesterday we got to 70K, so we were popping for a while. So I just want to see if we can get to let's see if we can. I mean, we don't have to shoot for 70K now. Let's see if we can get to 3,500, because we got 140 people in here and we are popping. Can Prozac 5 milligrams be effective for anxiety? It doesn't come in a 5, it comes in a 10. It comes in a 10 for the capsules. Do you think it's possible to control OCD without medication? Yeah, you can use supplements like N-acetylcysteine, exposure response therapy, but severe OCD, you generally need stimulants or SSRIs. If you're diagnosed, I was diagnosed with ADHD. If you have a history of addiction, can a psychiatrist prescribe supplements or stimulants? Yeah, of course. There's some stimulants that are better for addiction, like the long-acting ones, like Vyvanse or Concerta. Jornay is really good too because it kicks in 12 hours later. How long should I stick with naltrexone if it started to give me some poor med side effects? I mean, I don't know. I would discuss it with your doctor. You have to, with any med, you have to discuss the benefits and the risks of it. That's all. Thoughts on Abilify injections over the pill? So Abilify injections, they're good, especially if patients are missing doses, then it's really helpful. What's your opinion on combining Wellbutrin with SSRI? Totally fine. You can do that, no problem. They work very differently. Do you think Intuniv, Lamictal, and Roxazine is a good combo for pediatric anxiety and ADHD? Tried ADHD stimulants, Prozac, Quellbree, way too activating. Yeah, so Lamictal can be counteracting, Intuniv can be counteracting stuff, but if you're trying to treat ADHD, none of those will touch. Intuniv will touch the inattentive ADHD, but it may not, Intuniv will touch the hyperactive ADHD, but it may not touch the inattentive ADHD. So, you know, when people run into combos like that, that's when I recommend getting a second opinion as well. And so I see a lot of patients actually for second opinions because they want to get my thoughts on whatever their regimen is and like see if we're a good fit to work together long term. So if that interests you, definitely look at, you can book it in my bio or just send me a message if you want to get a second opinion as well. Part 1, what grounds of there for involuntary confinement? I mean, basically if you're a harm to yourself or others and you have no, and you're losing touch of reality. Thoughts on LDN, low dose nitroxone. It's good for inflammation. It's good for a lot of inflammatory causes. What are the best meds to treat sleep anxiety with no withdrawal effects? I like supplements for that, magnesium and L-theanine. But if that's too mild, then you have to use more intense meds. Mirtazapine is good, trazodone's good. Hydroxyzine can be good short term as well too. Man, okay, we got about 4 minutes. 4 minutes. Actually, now is probably a good time to get rid of the covering, so that way the stuff will cook a little bit more. Because I covered it with aluminum foil, and so now I'm going to get rid of it to see if it can be crispier. Yeah, that's fine. Do you have to take ADHD meds forever? No, you don't have to take it forever. Of course not. ADHD meds are kind of like glasses. You take them when you need to, but when you don't need to take them, you don't take them. Jobs for people with a bachelor's in psych. probably you have to get a master's or like a PhD or something. Psych doesn't really lead to any jobs. You have to, I mean, you could go to med school, go to nursing, something like that. You could become a coach. Do you get hungry during the day, only eating once? Maybe at night, but then I'll just drink a bunch of water and I'll be fine. Yeah. But no. I think I get more hungry when I eat multiple times a day because your body's constantly queuing for food. Whereas if I eat once, I just get my eating done and then I move on with my life. How to be afraid of not other people's opinions? By being more confident in your own opinion. That's how you stop being afraid of other people's opinions. So, getting off amitriptyline, what are side effects? I mean, brain zaps can be one, maybe fatigue can be another, but don't think about side effects unless it happens already, because then you might cue yourself to having side effects. Favorite SSRI with least side effects and most effective lower dose? Probably, honestly, I like Prozac. Prozac's my favorite one, like 10 milligrams. 10 to 20. What do you think of psychodynamic? It can be helpful for the right motivated patient, but it's not the right choice for everybody. How can we eat once a day? It's just fun for me. How come we don't combine Aldon, Risperidone? Because they're both antipsychotics. So you typically want to use one for that. What's the best med? Oh, awesome. We have 44K likes. So let's see if we can get to 50K. So definitely tap this. Double tap the live if you're liking this, and let's see if we can get to 50. So we have about 3 minutes before we eat. Best one for health anxiety. Best what for health anxiety? How to debate with the local psychiatrist. What are your thoughts on what separates bipolar, CPTSD, ADHD? They have different diagnostic criteria. Those are very different diagnoses. I'm a doc that wants to switch and do a master's in health law. What do you think? I think that's a waste of time. Thoughts on Quellbreep. See, the problem that a lot of medical people run into is that they just want more education, because all they know is more education. Well, do it only if you have a clear career path in mind. Whereas if you're just doing it just to avoid the real world, then no. Then don't go into more school just to avoid more real world. How do ADHD meds work? They're stimulants, so they stimulate your frontal lobe. Best med for health anxiety? I mean, just SSRIs in general. Can you be diagnosed with ODD as an adult? Sometimes. Not really, though. Then I think you would be more like NPD or something else like that. Risperidone and Depakote not working together. That's usually used for bipolar. Also, yeah, so we got 175 people. So press 1 if you're a provider, and type 2 if you are a patient. So I'm curious what our breakdown is right now. Who the weekend squad is. Who's the Saturday squad. And yeah, say what kind of provider you are, whether you're a PMHNP or MD or NP or PA or psychologist, whatever. 1. PMHNP, nice. We got a good mix here. PMHNP, nice. 1. Okay. S, I don't understand your question. 1, also 2, yeah. Okay, nice. Yeah, so if you're a provider, I definitely want to hear you. Oh, nice, it's about that time. Definitely want to hear your questions as well, too. Clinical stuff, case stuff, etc. Patient and lawyer, yeah. Or like 3, right? Like you don't have to be a patient, just like an everyday person interested in this stuff. Nice. Okay, so let's at least get some of our food ready. The way I like to do it is I will have it in tiers. So I'll get some stuff out and then leave the rest. Okay. Can meds help with dissociation? It depends on what the dissociation is underlying. like what the underlying thing is that's causing the association. But all right, man, I wish you could smell this. It smells good AF. What are your favorite off-label prescriptions? I like clonidine and guanfacine for ADHD, and some of the SSRIs for PTSD. That's what I use off-label a lot. Okay, perfect. Now this I will put away. This I'll put here. This I'll turn off. Maybe I'll get a little bit of broccoli here too. Kind of mix and match a little bit, mixy. Put that down there, and then put this back. So I like to once I finish cooking, I don't want it all out. I just want it to stay warm. So I'll leave it in there and let it cook for a while. Let's see if we can get to 15K exactly. We're all working together as a team here. We're at 73, so definitely double tap this if you like this. How do you deal with patients who come in with TikTok, learn terminology? That's a really good question. Let me answer that. How do you deal with patients who come in with TikTok terminology? How do you deal with patients who come in with TikTok terminology? So the way which so I actually gave a talk on this at the American Psychiatric Association APA meeting a month ago on TikTok and overdiagnosing all that stuff. And basically, it's a whole epidemic where people will see these diagnoses on TikTok and they'll be like, oh, I have it, whether it's ADHD or Ehlers-Danlos. There's a couple others like that, some EDs as well. And the what you do if a patient comes in with it is you just explore it with them openly and honestly. You don't want to be judgmental because they obviously could have it, but at the same time you keep it in the back of your head. And when they say that, for example, the patient says they have Ehlers-Danlos, or they could begin to recite criteria for Tourette's or something. Yeah, you just explore the criteria with them, but at the same time, you just try not to be judgmental at all, because you never know. Because I think the hardest thing for us as providers is when you see a whole bunch of patients who are just claiming that they have diagnoses, that's when you might roll your eyes internally and then be like, here we go again. But that's the urge that you want to avoid, because preserving the therapeutic relationship is the most important thing that you can do. All right, so let's test out how this came out. Pretty good. I think I'm gonna add in, black pepper is my favorite, so I'm gonna add in more black pepper. That black pepper chicken. This is a cooking class. No, I am no chef. I'm just someone who eats the same meal every day, and I always just go live when I do that. Hi, are you the doctor that speaks about, I know about ADHD meds. Are you aware of pure OCD? Yeah, it's just pure intrusive thoughts without compulsions. Am I sure DSM-5 is that the symptomatology overlaps? Yeah. It's not a perfect diagnostic system. It's just what we have so far. But I think a better diagnostic system would be more genetic based. or biological based, like catering to different biological mechanisms and biological criteria. Just like we know for diabetes, and A1Cs has to be higher than like 6.2. So that's a work in progress. Where did you go to medical school? I went to medical school at the University of South Alabama. And then I did my psych residency at the University of Western Michigan. And then I did my child and adolescent fellowship at Northwell Health in New York. So definitely double tap this if you enjoy it, if you like this live. We're almost at 10K. Let's see if we can get to 12K. It's amazing you eat the same thing every day. Yeah, I feel the best. This is what I feel the best eating. And so now you have proof here. Which medicament? How do you overcome health anxiety? What's the difference between psychology? Wow, the questions are just flooding in. So if you want me to see your question, prioritize it a little bit. Definitely look at subscribing, because if you subscribe, then I am able to see your questions. I'm able to see your questions more. They stand out more than everyone else. Oh, I got my PMHNP at USA. Nice. Go Jags. Go Jags. In confinement, I have no idea what your question is. Yeah, I think if you want to get a good answer to your question, you have to ask the question concisely and clearly. And so I would definitely read over your question, because I have no idea what that's saying. Do you work with primarily children and adolescents now? I do both. I do children and adolescents 50% and adults 50%. So I think that's why a lot of our students in our coaching program are really getting good value, because I'm able to offer advice from the adult psych of things, but also the adult or from the child psych of things too. Can Seroquel cause cardiac problems? It's not really known for that. Maybe like high doses, but Geodon's more of an antipsychotic that can cause that. Can olanzapine cause sleepiness? Yeah, it can be sedating. That's why it's a decent choice for bipolar, like bipolar mania, because it can help people go to sleep. My son is in psychosis. Yeah, so if you want me to assess your personal situation in more detail, best way to do that is to book a consult. So if you book a consult, you can book it in my bio, and we can see if we're a good fit to work together. Yeah, so definitely if you wanna see if we work together, if you want to get more of a personal look at your situation, best way to do that is to book a consult. Yeah, and all my information, like insurance wise, etc., that's all in my bio as well too, so you can see that. Wow, we have 242 people in here, so we are popping. So definitely, if you like this, then definitely like this too. Let's see if we can get to 15K likes. Tips on how to not make Latuda lock me out. To knock me out, yeah, take it at night. Take it at night, yeah. There was a postpartum mom that needs help. Yeah, so just send me a message, or send me a message asking about consult. Say consult. What are benefits of not being a PMHNP? Deciding if I should go to school for it. So It depends. If you want to do floor side, bedside nursing, then you continue to do that. But if you want to do more thinking like a provider, be the one responsible for the patient's care, be the one prescribing the medications and the treatment, there's more responsibility being a PMHNP. So if that interests you, then definitely do that as well. Why don't we just do the... Wow, the questions are popping. Yeah, definitely popping. Right, so there's 220 people here, so people are really coming in. So yeah, definitely look at subbing too if you want your questions to stand out. There're just so many. Does therapy help with anxiety? Yeah, of course. What do you think about clinical psychologists prescribing? That would not be a good idea. You have to have a background in medicine to prescribe. You should, because medications are very dangerous if not knowing how to use anything. Did you work in psych prior to becoming a PMHNP? So I didn't become a PMHNP. I became a psychiatrist, but I coach PMHNPs. So I have a coaching program where I coach PMHNPs. Why is autism diagnosed by psychologists? No, it's not. It's diagnosed by both. Psychiatrists and psychologists diagnose autism. Neurologists diagnose autism as well. Nurse practitioners are prescribing like crazy in Illinois. Probably because there's a big shortage in Illinois. I'm sure there's a lot of providers or a lot of mental health needs in Illinois. So NPs are helping step up to fill up that the NP shortage. Salmon is toxic. Well, I guess I'm getting poisoned then. What can psychiatrists perform that PMHNPs cannot? Usually like big evaluations, more complex cases. We just have a higher degree or a lot more in-depth training, and so that's why that's why it's all a collaborative model where like a PMHNP tend to work and get guidance from a psychiatrist. But like one is seclusion and restraints, so that's a big one. So I work at a prison, and there only a psychiatrist is able to do seclusion and restraints, for example. But I think things are shifting, and so what a lot of the PMHNPs in my program tell me is that they felt like their education was not that good, and they don't feel confident seeing a lot of complex cases. And so that's why I was like, okay, I got to do something to help this. Is it possible to add an SR dose of Wellbutrin in the afternoon? Yeah, you could. Typically it's not done. Typically you don't mix SR and XL, but you could. Do you have favorite conditions to treat? Probably anxiety, depression. Yeah. Sometimes ADHD as well. I really like people who have good functioning, and so if they're able to have a lot of insight into their illness and they're like wanting to make steps and like actually follow through on what they say, that's been a big help. Definitely double tap this if you're enjoying this. What do you do in your PMHNP training program? So I have a whole list of recorded modules on pretty much all the psychiatric diagnoses, how to diagnose different psychiatric diagnoses in complex patients, all the different medications. So let's say you have a patient on Vibrate, for example. You're like, how do I treat with Vibrate? Or how do I treat with Seroquel, then you could look up my module on Seroquel and know, okay, this is how you treat a patient with Vibrate or Seroquel. Supplements, how to use supplements holistically. So I have a whole bunch of modules on that, on case reviews, on tough cases that I've done. But I think the most valuable thing is the Q&As. So every week we do a live Q&A where you get to come in and ask your questions to me, like about cases you're seeing, about concepts that you don't really understand. If you want me to explain things like, okay, how do you treat bipolar and ADHD together? So I'll explain how to treat bipolar and ADHD. Or how do you cross taper from this med to that med? So I'll explain how to do that, for example, or how to help a patient taper safely off a med. So that's the kind of things that we discuss in the program. And so the best way to do that is either to send me the message, who is in the Q&As. It's just us. It's just other students in the program. So that's why it's exclusive. So it's not for like the everyday person. It's only for us, like, you know, me and then our PMHNP students. Like, that's it. So all that information, so just send me a message if that interests you, or you can check it out in my bio. All the info's in there. Awesome, thank you. Thank you, 15K likes, let's go. Thoughts on low carb diet? I eat that every day. I think it's one of the greatest things for mental health. What are Latuda and bupropion used for? Latuda is used for treatment-resistant depression, bipolar depression, schizophrenia, psychosis, bipolar. Is Vyvanse a high, 50 milligrams Vyvanse a high dose? It's a good dose, but it's not a high dose. It's not a super high dose. Can PMHNP students join the coaching or just for PMHNP? They're new grads, both. So it's for, we have some students in the program as well as new grads. And in fact, students are a great time to join, because then once you get into precepting and once you get into like seeing a collaborating psych, then you will be so much far ahead of everywhere else, where your preceptors are going to comment, wow, you know a lot. You know, you'll be able to see a patient and feel way more confident and be way more successful than if you're just coming in for without knowing that. So we have a lot of students as well in the program. Auvelity, yeah, Auvelity is good. It's bupropion and dextromethorphan. Basically helps with low energy depression. Thoughts on lithium for bipolar? Yeah, it's known as the gold standard, so it really helps treat bipolar mania. It's a solid choice for that. Is this recorded? Good question, actually. Yeah, so I upload these on YouTube as well, so you can always watch my live streams on YouTube. But TikTok doesn't allow, like, you know, you can't really post a full live on TikTok. So that's why there's only coming in live during the live is the best time. Also, we're at 15K likes. Let's see if we can get to 20K. Let's see if we can get to 20K likes. Why do you only eat salmon and broccoli? I mean, it's just when I eat when I'm at home. I like having one standard meal that keeps me healthy and keeps my brain sharp. It's wild caught. I should get some salmon stocks. Awesome, Jill. Thank you for the sub. Appreciate it. So now if you sub, your questions will stand out above everyone else's. So, all right, BRB, just getting some more food. In the meantime, hopefully that view is nice and enjoyable. Okay, now we're loading up all the food onto our plate, so I will be back momentarily. Let me just load up all the broccoli now. Excellent, excellent. Okay, awesome. Thank you for waiting. Menopause is horrible on mental health. Yeah, it truly is. The hormones can really throw havoc for somebody. Do GLP-1s help with GAD? Not really. They're more for, weight loss and stuff. But eating healthy can definitely help with GAD for sure. Damn. Came out surprisingly very good. Love it when broccoli is juicy. I think I was misdiagnosed. I have ADHD, but I have borderline PD. What do I do? So that's what I would suggest, getting a second opinion, because sometimes misdiagnoses happen all the time. So I really look at getting a second opinion. And if you want to get a second opinion, for example, from me, then best way to do that is to send me a message, or just say consult if you want a consult, like a second opinion. What else does your diet consist of? This is what I mainly eat day to day. But, if I go out and stuff, that's when I'll have more selection. Like I might have steak, I might have fries, other sorts of your chicken tenders, other things like that. But yeah, right now summer's coming up, so I'm just making sure that I look the part. Supplements for ADHD. Yeah, so I actually cover this a lot in my NP coaching program as well. So I do a lot of holistic health teaching my students and my practitioners on how to treat things holistically too. But ADHD, you can use L-tyrosine. Omega-3s are really good. If there's a lot of hyperactivity, magnesium is really good. And eating a high protein diet. And of course, sleeping well. You have for collaborative services for PMHNPs. So that's something I'm looking at opening up in the future. So either me being a collaborating psych or referring to someone in my network to be a collaborating psych. But so that I'm going to offer to my students in the program, because they're the ones that get to know the best. So they're the ones I trust with being a collaborator too. And then I'm also looking at adding in CEUs as well too. So definitely things are growing for sure. We've had over 148 people join in the past 3 months. So a lot of people are joining, a lot of people are hopping on, and a lot of people are staying because they really find it valuable for their education and for their patient care. Because a lot of my students tell me that their preceptors are crap, their collaborators are crap, or in their jobs or their schools, they don't really get taught that much, and they're forced to figure it out on their own. Keto diet for mental health and ADHD. Yeah, I'm a full believer in the keto diet. Low carb and keto all the way. What are your opinions on clinical psychologist? It's good. We collaborate and work together. Does anxiety ever go away? Of course. You have to work on it, get exposure to it, power through it, and then you level up. Thoughts on Spravato? Are you licensed in Georgia? I am. I do have a Georgia license. I did my med school in Alabama, so yeah, I have a Georgia license as well, since neighboring states. Why are MDs, POs, and PAs always talking badly about MDs? So see, that's another thing. So I got a lot of people talk shit about me when they found out that I was helping and coaching NPs, and I was like, well, I think it's better if there's so many patients out here that is, I mean, if you just look out here, there's so many patients out there. It's better if we work together rather than work separately. But I think a lot of MDs and NPs, they talk shit about NPs because they have a scarcity mentality. So they think that their jobs or whatever are going to get stolen. When in reality, there's more than enough patients and more than enough work for all of us combined. And see them, they're just talking shit. I would rather be part of the solution. You know, we all work together to help out the mental care shortage and help out patients rather than being part of the problem, which is just bitching and complaining with each other. Do you take students? Yeah, so we have a lot of students in our academy, actually. We have a lot of PMHNP students. So definitely check that out. Shouldn't I be talking about summer bodies and diets? No, it depends. That's like saying I shouldn't be talking about driving problems because people have gotten in a car accident before, like how to drive better. Well, that's why it's not tailored towards an audience, you know? I tailor towards a specific audience. Do you do EMDR? No. But I refer out to clients who do EMDR. You don't fix autism, you treat it. You treat some of the problems with it, and you help them get more adjusted and better with society. It's your platform, right? Exactly. See, it's so funny to me. It's like people come into my live. It's like, imagine if you go into someone's house and you say, hey, you shouldn't be putting this on the wall. You shouldn't be talking about this. Well, it's like, this is my house. I can talk about what I want to. You are coming into my house. So similarly, when you are on my channel, you're coming into my channel, my house. So if you don't like it, you scroll up. But see, here's the key. The people who do like it, who do vibe with it, then they stay. And so that's why you should never filter yourself online. This is a lesson for anyone, you know, especially if you're watching, you want to get started on social media or you want to be online. Now, don't filter yourself online, because the people who like you will gravitate stronger towards you. And the people who do not like you will talk shit. But either way, the people who talk shit give you free engagement, and the people who like you get more value out of you. So it's a win-win either way. So, you know, and everyone has their own opinions and stuff. And then furthermore, if you suppress yourself, then you literally become a textbook. And people tune in to talk to real people. Like, you got live because you want to talk to real people. You're not coming live to have some textbook talking to you. That's the difference. Do you think SSRIs can treat ADHD symptoms? Not really. It could treat some anxiety. How do you cook your broccoli? Just in the oven. Hearing about ADHD being the umbrella, there's subtypes. Yeah, there's two subtypes, main ones. There's inattentive and hyperactive. And then also impulsive. Those are the three different subtypes for ADHD. What are your thoughts on ADHD meds for teens? I mean, if they need it, they need it, because untreated ADHD is a big problem for teens as well, because it can cause school problems, and then they don't get into college, or they don't get into the right work, or they don't achieve their potential. or they get suspended or something, or they get hooked on some kind of substance. So untreated ADHD is a big problem as well in teens. Hi. Ever see psychotic features that are oddly specific? Yeah, sometimes that can happen. Sometimes people will hear voices just based on like one person. Why do adults sleepwalk? Yeah, so that's something that's called a parasomnia. Sometimes there can be disturbances in sleep. In fact, it's so funny. I actually just made a lecture today in my NP coaching community on sleeping, on the different types of sleep disorders as well too. So if you're a PMHNP and you've struggled with treating patients who have sleep problems, then definitely look at joining a program as well too. So that way you can really learn about sleep treatments, because it's really hard, and a lot of times people don't teach you how to treat sleep problems effectively. So yeah, just send me a message if you're part of that. How do you deal with medication being overused or stigmatized for mental health in your practice? Well, it doesn't really happen in my practice, because I see private patients, and so people come to me for that reason. But, with any kind of medication, treatment, whatever, there's always benefits, there are always risks, and the different choices are important for different people. You never want to go off your meds cold turkey. That's not usually a good move. You almost always want to taper them. If I procrastinate, does it mean I'm mentally sick? No. Procrastination can be a sign of ADHD. I mean, that's very common. But, just a sign that your habits need to be better, right? You can always level up, and you can always get better. What are you eating? Chicken and broccoli. Yep. You missed the salmon from earlier. Nice, we're cooking here. We got 200 people here. So if you're liking this, definitely double tap. Let's see if we can get to 25. We got to 70K last night. Let's see if we can get to 25K. Hi, Anne. Any tips for managing pure O? Yeah, you can do exposure therapy. N-acetylcysteine is good. SSRIs as well. The best question to ask when looking for a PMHNP to evaluate, diagnose first. Yeah, that's what always happens. When you go to a psychiatric evaluation, you get a diagnosis, and then the treatment is based off the diagnosis. Like, that's how it always goes down. I'm taking Ativan 1 milligram a day. Is that okay? My hubby is PMHNP too. Nice. So I'm actually a psychiatrist, but I coach PMHNPs. Is it better to shadow with the psychiatrist or NP during clinical? I don't think it matters as much. What matters is how much exposure you're going to get and how much hands-on training you're going to get. Like, shadowing versus them actually watching you do the training is leagues better. But Monica, if your husband's a PMHNP, then they might be interested in our PMHNP coaching program too. So definitely look at that. After I pass my boards Monday, I'm joining your program. Nice. Well, good luck on the boards, and we shall see you inside afterward. We have 148 members right now, so I'm curious who the 150th will be. Do you go live every day? Yep. My goal is to become the biggest psychiatrist on TikTok live. So that's my goal. So you're tuning into the early part of that show. So if you're an early adopter, you're part of the startup right here if you see it. Who is the biggest right now? I don't know. I literally have no idea. I don't know of any other psychiatrist who does live streams. Like, I know there's some who post on TikTok a lot. I mean, I think Dr. K is the biggest on YouTube. But I don't know who's the biggest on TikTok live. In fact, actually, TikTok is recognizing these lives because they've contacted me and they said that they want as well. Actually, I've been working with a coach from TikTok, and like we're in email. We have meetings every couple weeks, just like tracking my progress. So I think TikTok's definitely they're definitely pushing this. There's a female neuroscientist that's very possible, but not an MD. Yeah, so a little bit different. So I'm gonna be the biggest MD psychiatrist on TikTok. That's my goal. Love your eating habits. Thank you. And see, this is what I hope to do too. Is like a lot of people have come on and they've said that they've changed their eating habits. Watching this, and this is what I'm telling you. Like it's not just me. There's a difference between me telling you, like a doctor saying, "Hey, eat healthy," but they're 300 pounds, versus me telling you, "Hey, eat healthy. It's good for your mental health," and then you literally seeing that that's what I do every day. Could you prescribe symptoms of ADHD? You mean to prescribe symptoms? So the ADHD is broken down into 3 categories. There's inattentivity, there's inattentive, impulsive, and hyperactive. Those are the 3 different types of ADHD breakdown that is. Okay, are we good now? We're at 25K. Let's go. Let's see if we can get to 30K. We got to 70K last time. You motivated me to buy salmon and broccoli. Awesome. Thoughts on finasteride for hair loss? Yeah, I take it every day. Why are you always live? Why are you always watching lives? My propranolol and trazodone raise liver enzymes. Yeah. Propranolol and trazodone raising liver enzymes. That's unheard of, actually. I mean, actually, I'm sure it's happened, but it's very unlikely. Dr. Alok Kanoj is the biggest doing live stream. Yeah, but he does YouTube and TikTok. YouTube and Twitch. I'm not aware of TikTok. I don't think he does TikTok live streams. So that's what I want to take over. No, I don't take. I take some multivitamins. I take iron and vitamin D. But in terms of medication, I take minoxidil and finasteride to help me with hair loss. What do you think is the best medication for OCD, anxiety, and combo? That's where I recommend getting a personal consult, because there's no right medication. There's what's the good combo for you. Do the same thing every day. But I am running out of broccoli, so I need to get more. Please answer, what was the question? Do workout, yeah. So I weightlift 3 days a week, and then do cardio once or twice. Can you take propranolol and fish oil together? Yeah, totally. Yeah, do you take insurance? Yeah, so all my info is in my bio or my consult page, so just check that out. Thoughts on GLP-1s? Yeah, I use them for weight loss. For, like, not me personally, but I prescribe them for weight loss for my patients who might have gotten antipsychotic weight gain, for example. Please help a broker with some advice. What is the question? Ask and you shall receive, but you must ask. What do you think of mirtazapine? It's a good medication for sleeping, weight gain, and depression and anxiety. What meds are good for weight loss? Vyvanse, topiramate, GLP-1 agonists, metformin. Okay, so let's see if we can get to 30K likes. We're at 26.9. I want to see if we can get to 30K. So just double tap this if you're finding this helpful, if you're getting some value, if you're having a good Saturday afternoon or whatever time it is for you. And yeah, let's see if we're a good fit. Dr. Melissa Shepard, 1.5 million followers on TikTok. Yeah, so I know she's been around for a while, but I don't think she's active anymore. Like, I don't know if she still does live streams. Like, if you check her videos, they don't post very often. See, I think the difference is that I'm young, so I have a lot of young energy, and I'm wanting to conquer the world. Do you think a nurse should go for FNP and then PMHNP, or just do PMHNP? Probably just PMHNP. You want to get more clinical experience and less admin type of degree experience. More degrees doesn't make you a better provider, but better clinical experience and mentorship is what will make you a better provider. How do you feel about Vyvanse for a 22-year-old? Yeah, that's totally fine. I have plenty of college-age students on Vyvanse. Do you eat carbs or mainly protein? Mainly protein, but some carbs. On a Abilify, I've been studying nonstop, or sleeping nonstop. Dr. Shepard was live 1 day ago. Nice, awesome, good for her. I'm on Concerta, but it makes me not eat, and then I binge. Okay. So you gotta stop the binging. Is it bad to take Vyvanse in the AM and Ambien at night? I mean, it's not ideal. That could be a sign that the Vyvanse is lasting too long and it's causing sleep issues. But also see the difference is that when you have different docs and different psychiatrists on, they have different opinions. So it's good that way you can kind of bounce back and forth and then see whose opinion you like. What's your cheat food? I like French fries. I like popcorn. I like chocolate. Peanut M&Ms. Best medication, early onset schizophrenia, antipsychotic. Antipsychotic for sure. How come antidepressants don't actually work? Well, it may not work for you, but they work for other people. I'm on olanzapine for PTSD and my nightmares got better. Yeah, I used to work at the VA and I prescribed a lot of Seroquel for like a lot of PTSD hyperarousal, and that made a big difference. So olanzapine is similar. How long did your school take? Too long. I went to college in 2011. I started med school in 2015. I started residency in 2020 or 2019. And then I did my child and adolescent psych fellowship in 2022. So yeah, a while. Do you medicate trauma or wait and monitor? No, you don't want to be waiting and monitoring for trauma because that will impact someone's life. You want to address it as early as possible before it gets a chance to really settle in. Where in the US are you? Guess. See if you can guess. Also, yeah, if you're liking this, definitely double tap the screen. And so to give it a like, let's see if we can get to 35K. Let's see if we can get to 35K. Nice, we're at 32. I feel like no career is right for me. What should I do? Well, nothing's going to be right for you immediately. It comes with time. You have to try a bunch of stuff and then until you slowly get closer and closer to the truth. Success doesn't just happen when you think about it. Success happens after time. Literally, like, success will take time to happen. Overthinking, yes, everyone overthinks. Can social worker perform counseling? Yeah, I think a lot of social workers get some counseling work and training. Also, yeah, so, okay, we're at 34. Let's see if we can get to 35K likes. Let's see if we can get to 35K likes. We're at 34. I'll be right back. Do you use clozapine in the US? Yeah, we use clozapine quite frequently, actually. All benzos work for everyone. I mean, they're good, but they definitely have their cons. Why is mirtazapine so sedating? Because it's antihistaminergic, and histamine keeps us awake, so antihistamines help us sleep. What caused? Oh yeah, we're at 35K. Awesome. Let's see if we can get to 40K. We have 250 people here, so we are cooking. We are definitely we're definitely cooking here for sure. Also, so let's see who is a. I know we haven't asked in a while. We have a new thing. Who is a provider? Say one if you're a provider and what kind of provider you are, and say 2 if you are a patient, and say 3 if you're just an everyday person who enjoys this. JBMD, I remember you. You were the optho resident, right? Kenechi, PMHNP, welcome. 3, can you like a live more than once? Yeah, you can double tap all you want. 1 and 2, 3, 3, 2. Adult Jero NP, 2, 2. Nice, 1, 1. LPC, 2, 3. Okay, so we have a good mix here. We got some 1s, 2s, and so 1 is provider and say what kind. 2 is patient. 3 is like just everyday person who's into this content. Psych RN, where can I ask 2? 37, yeah, well, trying to get to 40. Let's see if we can get to 40. Double board certified cardiothoracic surgeon. Ooh, no pressure. Scary. 3, 3, 3, 4. Nice. So we got a good mix here. We got some 1s, 2s, and 3s. Yeah. So if you're a provider and you have any questions, like ask. Now is the time to really ask. And if you're a PMHNP as well, because I have a PMHNP coaching program, so like that's what I do all day is I coach and teach PMHNPs. So let me know like what kind of issues you're having, patient issues, case issues, problems with jobs, job searching, etc., etc. $38K, yeah. Let's see if we can get to 40. What is your go-to medication for treating anxiety? Typically, you would start with an SSRI, but you can mix other stuff. Why do most of my patients get frontal headache on Wellbutrin? It's because Wellbutrin is very stimulating. It literally stimulates the frontal lobe. So I think it says you're an MD, right? Yeah. So it literally stimulates the frontal lobe. And so because it stimulates the frontal lobe, sometimes, you can have too much dopamine or norepinephrine activity, hence the frontal headache. But the reason for the frontal lobe stimulation is that's why it helps with ADHD. How often do you meet with your mentees? We meet every week. Every week we meet. Every Monday night at 8 p.m. Eastern Standard Time, we will have our NP coaching call. So if you log in at 8 p.m. Eastern Standard Time, you can literally see the coaching call, because I'll live stream it. But yeah, that's where my students will ask me questions about patient cases they're seeing, understanding different diagnoses, the intricacies of treating stuff, like for example, how to cross-taper meds, how to treat insomnia in geriatric populations, how to treat aggression in autism, how to develop a better relationship with the patient. They'll give me a case and ask for my thoughts on it. So those are the kind of questions we do. So like if you're really interested in leveling up as a Psych NP, you really want to understand psychiatric diagnosis, psychopharm, way more detail, especially to like the level of a psychiatrist, right? Then that's definitely you want to join, so that way you can learn and we can all work together. If you have cases you want to staff, then that's really helpful as well too. Yeah, because you want to feel confident in your job. You don't want to feel like you have imposter syndrome, and you don't want to keep feeling that patients don't respect you or other providers don't respect you, because let's face it, if you're an NP, a lot of other providers are talking shit about you. Whereas what I say is that level up your psychiatric skills so much that they have no leg to stand on when they talk bad about you. Losing track of time, but can't reach specific goals. That could be a sign for inattentive ADHD. Yeah, procrastination, losing track of stuff is a very common sign of ADHD as well. So that's why I see a lot of people for second opinions and for consults as well. So if that interests you, definitely send me a message. Oh man, I think, this thing got moved. I'll put it right there. Keisha says, oh man, I already lost the question. Keisha says, I am a PMHNP go-to. I am a PMHNP go-to treatment for dementia with behaviors combative. I use risperidone. Yeah, so risperidone's good. I like quetiapine, Seroquel a lot too because it's sedating. So that's good. Those can both be helpful for sundowning. I've had some of my students have had good success with Cobenfy, some of the newer ones. That works as well too. You can use a low dose benzo. You don't want to use obviously too high because it could knock them out or cause paradoxical. But generally, yeah, antipsychotics are a good one. Can actually ask, have you heard about telehealth core? I have not heard of telehealth core. No, what is that? Why can't I get over my ex-girlfriend? Because you're spending too much time thinking about her rather than thinking about how much you should level up in your own life. I have ADHD, I can't afford medication. I mean, that's when you do more natural stuff. You can do healthy plant-based or protein-based diet, L-tyrosine supplement, and a lot of ADHD meds are very cheap. Like, they're all generic. Do you have a hair transplant? I do, yeah, I got one last year. I'm a geriatric psych RN. Where can I learn about more meds and conditions? Yes, so that's the reason I started a coaching program teaching psych NPs, was to teach them what I know about medications and different psychiatric conditions, and to monitor and to help them with their own cases, as a psychiatrist. So yeah, if you want to really learn about meds and you're in the field and diagnoses, then the best way to do that is to join our program. And you can send me a message for it too. Do you deal with OCD? Yeah, I treat plenty of OCD. Lots of OCD. What's best for DPDR? Finding out what are the underlying causes and making sure it's the right diagnosis. I think that's more of a TikTok diagnosis now. What kind of vitamins? Iron, vitamin D, and checking if you have any kind of underlying issues too. Thoughts on California rocket fuel? It hits pretty hard. If venlafaxine is very stimulating, then mirtazapine sedating, so they combine with each other. I work with psych NPs. How do you feel about LAIs? They're pretty good. They're really good if patients are non-adherent or non-compliant with their meds, or if they have severe mental illness, then LAIs are a definite go-to. We use them a lot. I used to work in the community mental health, so that's where I used a lot of LAIs. I used to work a lot in the prison system too, so that's where I use LAIs as well. What other conditions can be treated similar to anxiety? Is Abilify good for ODD? Yes. Oh yeah, Abilify can also be used in geriatric aggression as well. Best medication for anxiety and PTSD? Probably an SSRI to start with. Is finasteride safe? I take it every day. Also, yeah, if you like this, definitely, Keisha, thank you for liking the live. Yeah, we're at 43. Let's see if we can get to 45K. Yesterday we got to 70K, so I don't know if we can beat that, chat. Are we good enough to beat 70K? Chloe, oh, I already missed it. SNRI saved my life. Nice. Do you think EMDR works for CPTSD? Yes, I do. Critical Hair RN here, starting PMHNP school in August. Any tips on what to do and what to study? Yeah, so make sure you understand the fundamentals of psychiatric diagnoses and psychiatric treatment as well too. Psychiatric diagnosis is probably the number one thing that you can understand, and so that's something where our coaching program can really help you. Like, if you are wanting to do PMHNP school and you really want to be like top of your class, that's one way to do it, is to know everything that they're going to talk about. And one of the ways is to join an educational program like ours. Prazosin worked wonders for my PTSD. Yeah, it's really good for nightmares. How do you know if your antidepressant dose is too low or too high? Basically, you get benefits, but without side effects. Do you eat anything other than broccoli and water? Yeah, I just had a bunch of protein. How do you feel about taking Adderall booster while on Vyvanse 70? Sometimes you have to do that. Sometimes you got to do it. Venlafaxine, yeah, hits pretty hard. Hits like a truck. I love broccoli. Yeah, it's my favorite vegetable. For venlafaxine, the problem is withdrawal. That's the main problem. Have you mentored any PMHNPs who went the non-traditional nurse route? Well, you have to be a nurse first before you can become a nurse practitioner. Like, that's how it works. But plenty of them do additional stuff once they graduate. Like, you don't have to go into clinical practice. For example, one I know is a MSL, medical science liaison. So they pretty much just travel around the region talking about different medications like Cobenfy. I'm curious about schizophrenic. Yes, I've treated schizophrenia in my past. How much such psychotherapy does a psychiatrist do? It depends. Some more than others. It just depends. Spravato, yeah, I use it. I mean, I don't use it myself, but I prefer patients to it. We also have a rep for our. Basically, if you want to learn about Spravato and you're an NP, we actually have a rep coming in to talk to our program and to our students about Spravato next week. So I'm gonna be having reps from different companies come in to talk to us and educate us. Does catatonia improve with time? No, and you need to have Ativan to treat it. Or ECT. What are your thoughts on lamotrigine for anxiety and depression? It's helpful for depression, not as much on anxiety. Best med for inattentive ADHD for teens? Some kind of stimulant usually. Buspar is good for mild anxiety, but not severe. Any suggestions for body dysmorphic? Yeah, group therapy, group treatment. Body dysmorphic, yeah. And then just like learn CBT to help normalize your thoughts. Have you had any mentees that did direct entry MSN, then go straight into PMHNP? Yes, we have, yeah. Some of my students have done that, yes. Do you prefer stimulant or non-stimulant for ADHD? I mean, both. It depends on the patient. Both can work. Med trials for anger, irritability. So I have a hierarchy with this. Like, let's say I'm treating an autistic kid or autistic teen. Then I'll start with clonidine and guanfacine first, and then see how well that does. And then if that doesn't work, then if I need something more severe, I'll go to the antipsychotics. But I will also look at other things. For example, I had this one autistic patient who was on Prozac 60 milligrams, and they were doing really well. So I was like, okay, let's bring him down. So I brought him down to 40. And then next visit, the family was like, no. Like, the kid's much more irritated, much more lashing out, and a lot more anxious. So we brought him back brought the Prozac back up to 60. And his aggressive behaviors went away. So definitely, if you have an aggressive person, also check if they, like an autistic kid or a teenager or adult, make sure you check that they don't have anxiety, or their anxiety is not crazy either, because that can manifest as mood lability. Also, Depakote can be used. So Depakote valproic acid can be used for aggression as well. Depakote or Tegretol. So those are other options. What is one thing Psych NP schools don't do a good job at teaching the students? I think real world stuff. So what a lot of my students have told me, and this was a problem in my residency as well. But what a lot of students told me is that they learned a lot about admin things, and they learned a lot about like writing papers and crap. But when it comes to the actual pharmacology of, okay, here's a patient in front of you, what do you do? Here's a complex patient case, how do you handle it? That is where a lot of my students found that they struggled. And also thinking like a provider, because when you come in as a like coming from the nursing side, then you are thought to think like you're a floor person, so you're on the field, you're following the recommendations and the orders from the doctors. But when you come in as a provider now, you have to change your thinking, because you're not thinking like someone who's taking orders anymore. You're thinking as someone who's giving the orders. So your responsibility has shot up from here to here. So you have to learn how to think as a provider. And that means being responsible for the patient. That means thinking about all the different systems that are going on. And that means being comfortable with a lot more responsibility too. So that would be the biggest advice that I would give. I like the background. Thank you. Appreciate that. What meds do you recommend for extreme OCD? So I like to start with SSRIs to start with, but clomipramine may also be used. Is there any online therapy that's legitimate? Yeah, they're all legitimate. I mean, plenty of therapists do online. What is PMHNP? Psychiatric mental health nurse practitioner. Abilify 5 milligrams. What is it used for? It's used for treatment-resistant depression, augmentation. You can use it for OCD. You can use it for aggression. Why do my psychiatrist prescribe lamotrigine for anxiety? It's a mood stabilizer. Do you have any patients you only provide therapy for? Yeah, I've seen some gaming addiction patients, so I should do mainly therapy with. Can an NP learn your job and a therapist job in 3 years? I highly doubt that. Would you recommend one? Yeah, I mean, so I see a lot of patients for therapy only as well, too. So I see a lot of patients as well for therapy. I have a couple of patients, actually. Most of them I do med management, but then I have some I do med management and therapy for. So if that interests you, definitely just send me a message. And actually, you can see it in my bio to book a consult, and we can see if we're a good fit to work together. What is the red drink? So this is sparkling water. So I like it's like flavored sparkling water. So sometimes if after a meal, if I want dessert, but I don't want to be eating ice cream and things. And obviously I do my Greek yogurt stuff, but if I don't want to eat anything else, then I'll use this sparkling water, and that helps my dessert cravings. And it's 0 calories. Jackie, what do we get for $99 a month? So we don't do any free trials, but everyone who joins pretty much stays. But what you get is all the different psychiatric medications, all the different psychiatric diagnoses, how to diagnose complex cases, how to treat complex cases, holistic supplements, how to use them, how to dose them, how to dose different meds, complex cases I get, and you get a live call every week as well, too. So quite frankly, I was thinking of increasing the price. I was thinking of doubling it because we've had over 150 people. Now we're at 148 people. So now is definitely the time you want to join, because I'm thinking about increasing, and because I want to keep it small. I don't want a community to grow so big that it just like blows up and my students can't get their questions answered. So I'd rather have it be smaller and everyone be able to have their question answered than have it be too big. So definitely now, you get a lot of value from it, and now is the time to join too, before price jumps. All right, we are at 50K, so this is awesome. So 50K, we have made it. Yeah, it's a live text. Yes, literally it's a live Q&A. Like you literally hop on and you get to ask whatever question. And if you ask me questions, and I answer any questions that are done beforehand too. So there's a thread where people will ask their questions, and then I'll answer them in the live Q&A, and then the session will be recorded for you. Is it considered ANA if I still eat? I don't know what that means. Is there, what's that doggy? Oh, it's so cute. Little corgi. Thoughts on countertransference with a patient who's angry and insulting. Thoughts on countertransference with a patient who is angry and insulting. Yeah, so you have to manage your own countertransference. Remember, patients can be angry and insulting, but you always control your reaction. So actually, in fact, I talked about this. I actually just made a lecture on this in my coaching program 2 days ago on how to discharge a patient, because I had a patient who was very angry and insulting, and I had to discharge her, and was demonstrating stimulant-seeking behavior, and so I had to discharge her, but I did it in a way that's very not defensive, but on the patient's side. So I said, hey, due to the issues with stimulant filling and with out-of-state pharmacies, I won't be able to fill it for you anymore, but I recommend finding out a patient in your area, give them 30 days refill, give them a nice formal discharge letter. And there's a whole process to how to discharge a patient effectively, because as a provider, you should never stand up to abuse from a patient. And in fact, if you do, what you're telling that patient is that that behavior is appropriate and they'll keep doing it. So for example, a mistake that I made was that the patient no-showed for a couple evals or appointments, and I normally charge for all my no-shows, but I decided not to. And what that did to her was that signaled that it was okay for her to misbehave, essentially. So that's what that signaled. So if you're a provider, listen very closely. Never ever tolerate disrespect from a patient. because your expertise, your knowledge, and your mental health is worth more than that. Yeah, I guess I'm a bleeding heart, so I do charge for no stress, but sometimes I'll give them the benefit, and it's always come back to bite me. So I think I need to start charging again. Yeah, I'm just bleeding hard. I guess I listen to more. Yeah. How do you handle new clients who make an appointment only to get disability? So that's why I do a consult. So that's something else I teach in the program as well, is how to do private practice stuff, like how to be able to have your own practice, how to build it, some of the business strategies with building your own practice as well. So that's a component too. Because no one teaches us that. No one teaches us this, how to start your own thing in school. So, but yeah, one of the things I do is that I do a consult before I see a patient for a disability eval. But I'll tell the patient straight that, hey, I don't do these kind of disability evals and stuff. It's only for my long-standing patients, or patients who have for a while, who I will do that stuff with. Are you doing a workshop? So if you just go to my page, you can download a free Q&A call that I've done, and you can see if that's something that you would like. So you can literally just go on the page and then get your free Q&A call. I have a high bar before calling it disrespect, working with SPMI. Right, you have to tailor it to the patient, obviously. But, for an ADHD patient, it's a lot different than an SPMI patient. Yeah, see, this is the kind of real discussions that no one will ever tell you. Like, no psychiatrist or psychiatric, like, no one teaches you stuff in the textbook, but this is the real life shit that no one teaches you about. And so that's what I also want to teach in our program too, is like the real life psychiatry. It's not just the stuff you read in a textbook, but real life stuff like this, like how to discharge a patient, how to do private practice, that kind of thing. Can ADHD in a teen be cause for social anxiety? Probably, but there are more separate things. Awesome, we're at 54K likes, and all right, let's see if we can get to 56. That should be an easy one. Last time we got to 70, so let's see if we can beat our 70 record. What is good for trichotillomania? Taking NAC, but NAC has to be at a good dose, so it has to be at least 2,400 to 33,000 milligrams per day, and that's something I advise my students as well too, is if you're treating for OCD, NAC is really good, but it has to be a high dose. What medication goes well with Celexa? I mean, nothing really goes well with it per se, but if it's not working, you want to get that assessed. Then you might need to switch it up. I have severe anxiety. I could take a med that isn't a benzo. So normally for anxiety, you start with SSRIs, or hydroxyzine can work as needed. CoQ10. I'm not an expert in CoQ10. That's more of a cardiac supplement, so I've never used it personally. How effective is lamotrigine for severe depression? It's good. Lamotrigine is good for treatment-resistant depression. I take clonazepam 0.5 plus a half of 0.5. Can I become addicted in that way? Addiction is more about the frequency. Yeah, I mean, it's hard to say. Everyone's so different. But addiction is about your genetics and the frequency that you take. Oppositional defiant disorder, what your ex? I'm not sure what that means. Does Ozempic make sweets taste sweeter or unbearable? I don't know what it feels like in terms of how sweets will taste, but it limits your cravings for sweets. My psychiatrist is trying to diagnose me and told me to keep records of things. What would you recommend? I track your sleep, track your mood every day. Those would be the top two things. Track if you're speaking fast, track if you're feeling more impulsive. What's the most common SSRI with the least side effects? Typically Lexapro, but some of the newer ones I've found have less side effects too, like Vilazodone, Vibrid, and Trintellix. What are your thoughts on Vraylar for schizoaffective? Yeah, it works well. Vraylar's a good antipsychotic, but Vraylar also has efficacy for bipolar stuff as well too, and some depression. Thoughts on psychopharmacology? Yeah, I mean, I think it's cool. I think it's cool that you can have certain receptors that can cause different effects in the brain, and I think it's cool to be able to tailor those to patients. Awesome, Keisha. Appreciate your consistent your likes. Lamotrigine versus Abilify for PPD. Lamotrigine versus Abilify for postpartum depression. I mean, either could work. Lamotrigine is probably going to be a safer option. less weight gain with it, but Abilify will probably work a little bit quicker. Tips on helping my 11-year-old daughter pick her skin. She has seen a therapist. Yeah, try N-acetylcysteine. How do you coach PMHNPs? Through a site. So yeah, so I have a coaching program. So if you check out my bio, you can see it there, or I can just send you a message and you can see that as well. So send me a message or either or. But yeah, so we have a site where we have a whole program. It's a community and a course. So you have all the different courses that I've created for Psych NPs, as well as our community. We can ask people questions too. How many patients do you see a day? So I only do clinical practice once a week. But I mean, obviously when I used to see patients, I would see like 10 or 12 patients a day. But now I only do them once a week because I'm focusing more of my time on my NP coaching program. Like I want to make it the best program for NPs in the world. And social media. So those are the two things I'm focusing on right now. Those are my priorities. What do you recommend for SSRI augmentation for severe anxiety? L-methylfolate can be helpful. Buspirone can be helpful. Can you explain why someone would pick a stimulant or versus not if it wears off by the end of the day? Yeah, you would do a stimulant. You would do a stimulant if... yeah, I appreciate that. You would do a stimulant if you kind of want it like glasses. You put it on when you need to, and then you take it off, and then it wears off when you don't need it. Whereas if you want more 24-hour coverage, then non-stimulant would work better. If stimulants cause appetite problems, then you could use non-stimulants, and if sleep problems have from stimulants, then non-stimulants could work. I was on Vraylar for a while, but I can't take it anymore. I'm not sure what cracking the tooth has to do with it. After how long is it not safe to just stop taking clonazepam? I mean, if you've been taking it consistently for a couple months, I would taper off of it rather than, I would taper off of it. For skin picking, look into fluvoxamine or clomipramine. Yeah, basically those are two SSRIs for, SSRI and a TCA for OCD. What are your thoughts on PMHNPs as an MD? Be honest, LOL. Yeah, so I'll tell you a story. So I remember one time I was in residency, and there was some new patient. We were doing a didactic lecture, and some new patient came in, and the patient was on Cymbalta, Zoloft, and some other SSRI, I forget, but they're on 3 different ones. And we're all seeing the patient. We all see the patient's chart, and one of my co-residents goes, "Oh, so who's the dumb NP who prescribed that?" So immediately I remember hearing that, and then as I started going on these lives, that's when I learned more about NPs and what they go through. And quite frankly, I think what's happening is that I think that the educational system is taking advantage of you. So I think that the schools are taking your money, the preceptors are taking your money, the collaborators are just taking your money and not teaching you. So that's what's happening. They're taking your stuff and not teaching you. And so that's why a lot of MDs talk shit about you, is for that reason. And in fact, I've had a lot of MDs talk shit about me, because in fact I got banned from the subreddit Noctur. It's a subreddit where MDs talk shit about NPs, and I got banned from it because I have a program helping NPs. And so I was like, okay, well, I have 2 choices here. NPs are asking me for help, so either I just go bitch and complain behind their backs like all the other ones do, or I work together and I do something to help NPs, so that way we can all work together and treat all the patients that are out there. Because I don't feel any kind of scarcity mentality. There's more than enough people out there who need our help. There's more than enough work out there for all of us to eat combined. So my view is that I would rather us be working together and be collaborating, rather than us be fighting amongst each other and talking shit. Because the real enemy, I mean, this is the insurance companies, but you have to remember the way that the insurance companies and other people who are at the top, the way that they stay there is they have the populace fighting amongst each other. The Romans literally invented the Colosseum and stuff to give the people theater so that way the people stay satiated with theater, so that way they don't rise up. So it's the same thing with Luigi. It's the same thing with politics nowadays. All the politicians, they'll feed us theater, like all these controversies that happen in politics and celebrity culture, because they understand that they get to keep you down and distracted by just feeding you lies and stuff. And so that way, if you fight among each other, then you don't fight the bigger evils that are out there. So to answer your question, I think that the bigger systems want NPs and MDs and stuff to fight amongst each other rather than us all work together. Because if we all work together, that's when there's a problem. Whereas if we don't work together, then we fight, and then the people at the top will stay at the top. Like, that's literally how it works. And now that I'm a content creator, like, I see it, like, I understand the game. Like, I understand that if I put out content, it will make people react in a certain way. So I can choose what kind of content I put out, and then people will react in different ways. So that's how the politicians and other people know how to act, basically. Who do you use for your billing? I do my own billing, but I don't work with insurance. So but I do out of network billing. So I have a program called Reimbursify that I use for out of network billing. So yeah, so that's another reason why people join, is because they want business knowledge too. So I have a whole business module that I'm developing as well in our coaching program on how to teach people about billing, business, all of that. So how to start your own private practice, how to be able to get patients, how to retain patients, all of that, how to be able to negotiate for more money, etc., etc. Because these are all the business skills, the real life skills that nobody teaches us as providers. Like, this is stuff that we have to learn. Is shadowing a psychiatrist a thing? Yeah, plenty of people shadow psychiatrists too. So yeah, if you're interested in joining, then definitely either send me a message, or you can check it out in my bio, and we can see if we're a good fit. All right, we're at 65K likes here. Let's see if we can get to 70K. We got to 70K last night, so I want to see if we can get that today. What do you recommend for highly sensitive person and overstimulation? Mindfulness. Becoming mindful of your own thoughts, feelings, and actions, and understanding that just because people say stuff about you, it doesn't necessarily mean anything. Do manic episodes increase during the summer months? Yeah, they actually increase a little bit during the spring. It's a big correlation between the spring, because now there's more sun coming out and people are not as inside and they're more awake. So yeah. All right, we're at 65K likes. Let's see if we can ever get to 70K. Do you feel like, so double tap this if you're liking this. Do you feel like some patients actually lie and want to be given a diagnosis they don't have? Yeah, I think some patients come in diagnosis seeking. Bupropion XR versus XR, yeah, XR for sure. SR is twice a day, and I don't like SR as much because then you have to take it in the later part of the day, and that can cause irritability or like sleep problems. Saba Ali, whenever I go outside, I feel stress. Yeah, everyone's different. For me, I don't like going outside that much either. I haven't left my apartment for like 5 days now. So, but that's me. Right? So I agree. I feel like psychiatrists either love or hate. PMHNP is no in between. Yeah, exactly, right? So that's something I teach my students, that yeah, there will be other psychs and will be other doctors who hate you, who will talk shit about you. Like, that will absolutely happen. But what I teach my students is that just level up so much that no one can talk crap about you, because no one can doubt your clinical skill. So that's what you should be trying to focus on. That's why my program is called Level Up Psych Academy, because you're literally leveling up your psychiatric skills in the academy. So yeah, level up, exactly. Paul, yeah, good to see you. Good to see you. This is one of our star students right here. Does deep TMS. Can someone heal from psychosis without medication? Depends on what the psychosis is from. If it's from like a BPD or something, yeah. But if it's like schizophrenia, then no. This is great advice. Appreciate that. Also, excuse me, sorry, or Manu and Pallavi. So I just finished a sleep module. I'll be announcing this in the program on Monday. but I'll give you a sneak if you're here on the live. So I have a whole sleep module that I'm working on, and I just finished recording most of the lectures for that. So I'm going to be uploading that very soon. I'm basically understanding the sleep physiology, like different stages of sleep, like, you know, N1, N2, N3, all the different meds used for sleep treatment, understanding how sleep works, how caffeine helps with sleep, parasomnias like REM sleep behavior disorder, narcolepsy, insomnia in general, natural holistic ways to treat sleep, sleep hygiene. So it's a whole module on sleep that's coming out on Monday. Well, I'm going to be uploading some of the lectures now, but fully on Monday. So stay tuned for that as well. I can't wait to see that module. Yeah. So actually, like after this, I'm gonna upload like over half the lectures. I did most of the recording this morning, and yeah, I'm gonna do the rest of it pretty soon. Hi, I take clozapine and olanzapine, Latuda for schizophrenia. I mean, that's because that's a lot of antipsychotics. Now, okay, we're at 68.5 likes. Can you, let's see if we can get to 70K likes here. Can you do an augmenting one, please? Yeah, I thought I did one on augmenting, but that's on my list for sure. Yeah, because there's some meds that are definitely used for augmentation. For example, for bipolar, for depression, you know, I could use Wellbutrin. I could use some antipsychotics. I could use Lamictal. I could use supplements. For anxiety, I could use buspirone. Hydroxyzine, propranolol. For psychosis, generally you'd want to do one antipsychotic, but sometimes you can add in another for like super treatment resistant cases. So yeah, typically if I'm augmenting, I like to optimize the first dose first. For ADHD as well too. I like to optimize the dose of the first thing before trying to do the second thing. That's very important. In my opinion, because you want to be able to get the most benefit you can out of one thing. Nice, we made it to 70K. Let's go. We got to 70K last time, and we just made it to 70K today. I wonder if we could get to 100K. I feel like that might be asking for too much. I don't know if it would be overreaching for 100. I don't know. As a team, could we do that? Could we actually make it to 100? That would be insane. Do you know why psychosis happens? Yeah, usually it's like people have brain problems, whether it's schizophrenia, whether it's bipolar, whether it's BPD, etc. But we're at 70K. Let's see if we can get to 75. How about that? We just go slowly, inch by inch. Is oversleeping just as bad as undersleeping? I don't think it's as bad, but I think it's still pretty bad. What do you think of 5-HTP? I think it's overrated personally. A lot of 5-HTP doesn't get absorbed in the brain. Are all the coaching programs on YouTube as well? No. The lectures on the coaching program are in the coaching program because it's for my students, right? Like that's where I'm spending all this. Like this is literally my full-time thing. I do patient care only once a week now because I'm putting all my focus on building this coaching program. Like I want it to be the best NP coaching program on the planet for psychiatry. Basically downloading all the stuff I've learned in psychiatric residency and fellowship into the program. Like that's my goal. So like that's what I literally work on 6 days a week. So that's my main focus right now. That and social media. Thinking of applying to a position working with substance use, homeless, SME, but not ready. So see, that's the thing, right? So a lot of people say that they're not ready for stuff, and so that's where getting good mentorship, getting good coaching is really helpful, because that's what helps you jump the gap between not feeling ready to actually feeling ready. Because anytime you start a new endeavor, you'll never be fully ready for it, right? Like that's impossible. But you want to feel as confident as you can. So just like I will feel a lot more confident going to the gym if I have a good workout plan and I have a trainer, rather than if I just go to the gym for the first time by myself. So similarly, right, you'll feel a lot more confident and in control and more ready to make big life changes like that by joining a mentorship program and being part of a program designed to help you rather than not. So yeah, we're at 72K. Let's see if we can get to 75K likes. Let's see if we can get to 75K likes, because we are popping. Nice. Yeah, I appreciate that. Thank you so much. Venlafaxine for ADHD. Yeah, it's decent. Venlafaxine can work for ADHD. It's not going to be a primary thing, but if there's a lot of anxiety happening, then you can use it because it's got more serotonin and norepinephrine activity combined. What are your thoughts on Vibrade? Vibrade's pretty good. It's what we call a serotonin modulator, so it tends to hit serotonin receptors in more specificity than just an SSRI, so it can help control the amount of serotonin. A psychiatrist prescribed 10 milligrams of olanzapine. I mean, that's a good dose. That's good for psychosis. How do you detox with all your patients' issues? I compartmentalize. Remember, my patients' issues are not my issues. So this is good advice if you're a provider. So your patients' issues are not your issues. So sometimes people will come to me and they'll be like, hey, I can't do psych because I take things home and take it personally. And I get that, definitely. But just remember that your patient's issues are not your issues. And so everyone has their own path. Yes, you can do what you can to help them. You can provide empathy and support. But ultimately, you are a coach on their path. You are not walking their path for them. That's the difference. And that's something I teach a lot too, is that you are a guide to their journey. You're not their savior. You're not the patient's Jesus or whatever. You are a guide on their journey. That's all. Are you open to being a collaborator? Yeah, so it's actually something I'm looking into. I haven't done it, so it's something I need to read up on and understand a little bit more. But it definitely is on my thoughts to open that up, to become a collaborating psych. And so that's something I'm gonna definitely open in my but like only for our students in our program, because I want you to have the exclusive opportunity, right? If you're part of the program, rather than just like anyone else do it, right? We gotta support our own people. And quite frankly, so if you're in the program, I trust you more. So that's why I'd rather be willing to take you on as a like a mentee, like to be your collaborator, because I can trust you. My husband's father's dying. How can I support him? I mean, give him time, give him space. Read the book Men Are From Venus, Women Are From Venus, Men Are From Mars. Because basically, when guys need support, we back off. Girls come together for support. So, for example, if I am struggling with something, I don't want to talk about it and be close to people. I want to just isolate, deal with it, and then come in. And that's probably what your husband's doing too. Is PMHNP oversaturated already? So people are talking about that, but I don't believe it is. So if you see all this, like there's so many patients out there, there's so many mental health care struggles out there, there's so many opportunities that there's opportunities for all of us to combine. And so that's something also I'm getting into teaching as well, is entrepreneurship and business. So that way you can really learn how to have your own practice and things, and how to be able to thrive in no matter how saturated things are. Because if you're in an economy or you're in a mindset where you're thinking, oh, it's saturated, won't be able to find a job, you're relying on other people. Whereas if you're able to really create a living, create marketing for yourself, get patients for yourself, then it's never saturated, because there's always enough people out there. Opinions on EMDR for teenagers, I mean, it's fine. There's nothing contraindicated against teenagers. Something about parasites. Yeah, so I do a lot of infectious testing a lot for my patients. So that's something else I'm going to be developing modules in our coaching program, is talking about functional medicine testing. So I do a lot of strep testing, infectious testing, mold testing, gut health testing, because if I can treat a lot of the underlying root causes, then I can help patients get better. So I've had patients who've had significant anxiety. I've gotten better just by treating their gut health. So, excuse me, but you have to know how to do that. Or I've had patients who I've treated for OCD because they had pandas, and they had it from they had strep infections. And so by treating the strep infection, that's helped their OCD as well. So Yeah, that's what we call functional medicine. That's something I'm teaching a lot in our program as well too. So yeah, definitely be on the lookout for that. A psychiatrist prescribed me clonidine for sleep. Does it happen often? Yeah, it happens decently. I use it for ADHD. Do you find a lot of resistance in the psych community by addressing mental health holistically? Yeah, some, but yeah, because it's taking away business from them, and also psychiatrists are only taught how to treat medically. Because we go through the medical model, and the medical model is very pharma based, and so if you want to learn this additional stuff, you really have to learn it outside of the scope of standard practice. Like, I didn't learn this in residency or fellowship. I learned all this stuff on my own. So integrative plans, right? Identified a problem and is addressing it. Others would rather be toxic and complain. Right, exactly. So my life philosophy is that life is a video game. And so that's why what makes a video game fun is if you're playing it, constantly trying to level up. And so if I am playing a game, I have to, and let's say I lose to someone, I only have two options. Let's say a boss beats me. Either I bitch and complain and I leave, or I level up and I fight the boss again. So most people would rather just bitch and complain. A few people will only try to solve the problem. So, you pick what you want to do. Don't hate the player at the game. Exactly. You just have to understand what the game is, and you have to play the game accordingly. Everything we do is a game. Every situation we encounter in life is kind of like a game. I don't know what FARHS syndrome is. I'm struggling with depression and SI. Do you have any tips to overcome that? Yeah, you missed all the lunch session today, but yeah, eat clean, sleep 9 hours a day, and then understand basic CBT to be able to change your thoughts and be able to correct your thoughts every time you have negative thoughts. What's the best antidepressant for low motivation? Wellbutrin is good. Prozac I like, is very stimulating as well. Other than that, none of them really target motivation. They just target a lot of the other negativity. You look 24. Yeah, I'll take it. All right, we're at 70K, 8 likes. Let's see if we can get to 80K. Actually, yeah, 82. We'll do 82K. Maybe we'll even be able to get to 100K. Hydrox tried Adderall XR today. My anxiety improved. Good. I'm glad that the Adderall XR made a difference. Yeah, Adderall XR. It's not as immediately stimulating. It's more gradual. All right, we're at 70. What time is it where you are? It's 7 p.m. right now. 7 p.m. Eastern Standard Time for me. Yeah, thank you for the likes. See if we can get to 80K. 80K. We got 177. We have 170 people in here. What SSRI is best for anxiety? I mean, they're all pretty similar. I like Zoloft a lot for anxiety. It tends to hit a little bit harder, but if it's not as good if you have sensitive gut health issues. How to stand out on my SEP4, M4? Yeah, basically be acting like it's called an acting internship AI. So be an intern, understand the meds, understand the diagnoses, pretty much know your patient's back and front, understand every medication or treatment that the patient's on, understand it. Stimulants can help anxiety. I mean, they can help with, if the anxiety is caused by ADHD, it could help anxiety. How do you overcome grief of a mom? Remember all the positive moments, and remember that she would want you to be happy. Spend some time supporting people too, being around supportive people. Your take on risperidone? It's a good antipsychotic. It hits hard, hits heavy. But it's not as good for mood stabilization, but it's definitely good for psychosis. Have you worked with a psychologist? Yeah, like some of my patients have their own psychologists. So, excuse me, some of my patients have their own psychologists, so I work with them. Call them and we'll chat about the patient. Real thoughts on CBT? It's very useful. It's such an underrated skill. Saad Ahmad, are you applying to psych residency or something else? Does anxiety ever go away? Do you have to wait to die? I mean, that's not true. How to deal with any feeling like you'll never amount to anything? I mean, you just gotta level up. That's the only way. You got to take action. Applying psych, see your lives a lot. Thinking about it is never gonna solve your problem. What's the best antidepressants for depression? Generally, you start with an SSRI, but there's other options that you can go to as well too. Awesome. We're at 81K likes. Let's see if we can get to 85K today. 85. Catch it, challenge it, change it. Exactly. So here's a basic life lesson for CBT. You have thoughts, feelings, and actions. It's a triangle. Thoughts, feelings, actions. And the whole goal of CBT is to acknowledge that, okay, your thoughts influence your feelings, which influence your actions, which in turn influence your thoughts. So you have to pick where to intervene. You can either change your thoughts, you can change your feelings, or you can change your actions. So let's say that you have thoughts that like, oh, I suck, I'm a piece of crap, I'm lazy, and then you feel worse, you feel bad about yourself, and then you lay in bed all day. Well, then because you've laid in bed all day, now your thoughts are, wow, I'm definitely lazy, I'm definitely a piece of crap, and then that whole cycle continues. So what you need to do is you have to reverse that. So the way you reverse it is by taking action. So even though you feel like crap, you still get out of bed. And then once you get out of bed, once you make your bed, once you get going, then you start having better thoughts like, oh, wow, I actually did it. I can do this. Okay, I can do this. And then you start feeling a little bit better. And then because you're feeling a little bit better, and then your actions start getting better. And that's the whole cycle of it. So actions, yeah, exactly. Talking positive thoughts about yourself, opposite action. That's the whole cycle. Thoughts, feelings, actions. And so you have to choose where to intervene amongst those thoughts, feelings, and actions. So you choose where to intervene. Actions are typically that's going to be the fastest to get you results, but thoughts you can do that more often too. But ideally, you combine both of them. All right, we're at 83. So let's see if we can get to 85K likes. 85K. Wow, this is crazy. 85K likes. Awesome. Let's see if we can get to that. How does olanzapine help as augmentation to antidepressants? So olanzapine has some serotonergic activity as well. So it's some 5-HT receptors like 5-HT1 or 5-HT2. So that's how it helps with with treatment-resistant depression or augmentation. Your thoughts on TMS? Yeah, so actually I'm going to be doing a live stream on TMS in a couple weeks. So basically TMS, I think it's good if you've tried a couple stuff and it hasn't worked. That's when you can jump to TMS. I mean, it's expensive. I just did a live on TMS 2 days ago with a patient who'd gone through it. And what she said was that insurance didn't cover it for her because she switched insurances and she had to pay 10 grand out of pocket. Now, she said it worked and it definitely made a difference, but she had to pay 10 grand out of pocket. So, I think it's good if you've tried some stuff and it hasn't worked and you want an intervention that's non-invasive. But you have to do it a lot. Like you have to show up every day to do it. You have to have 36 sessions. What's the best type of therapy? Oh, we're at 85K likes. Nice. Let's see if we can get to 90K. 90K. We are popping here. We got 189 people. We're watching. My phone battery is at like 22%. So let's see if we can... let's see if we can get to 100K likes here. That's expensive. Yeah, exactly. It's always an investment. You know, your mental health is an investment, so never be afraid to make an investment in your mental health and yourself. Instead of trying to invest in stocks or like other things, the best investment is an investment in yourself. You got it almost at 100K. Yeah, we're almost at 100K here. So definitely tap. Let's see if we can get to 90K. Dr. Mastani says, I'm on Lexapro 10 milligram, but I still feel anhedonia. Yeah, I mean, that could either be because it could be a side effect, or it just could be the dose is not high enough. So sometimes you just have to wait it out. SSRIs can take a while. Is there a recommended brand for magnesium glycinate? They're all the same. What's the best type of therapy for 87K likes? Nice. Thoughts on EMDR? It's good for trauma. Not gonna lie, it's hard to invest in anything these days. Life is rough. You can tell you really care about patients, not about the money for you. Yeah, it's about the game. It's about leveling up. It's a marathon, not a sprint. Exactly. Not gonna lie, it's hard to invest in anything. Right, that's where you gotta take actions. That's like if you're 500 pounds and you go to the gym and you say, hey, I can't ever lose weight. Well, it's gonna be an uphill journey for you, but you still have to get started. Cutting back on citalopram and 5 milligrams for a month. Any tips? Yeah, so if you're on 5 milligrams, that's pretty easy to come off of after that time. You know Lexapro? Oh yes, I'm very familiar. Nice, we're at 88K. Let's see if we can get to 90K likes here. 90K likes. Holy crap, we are popping. Take the actions, exactly. Docs on Rexulti and ADHD. Yeah, so Rexulti and ADHD, Wellbutrin, those are good for augmentation. 88.9K. Okay, we are rolling. Let's see if we can get to 100. Do you interact antidepressants? No. 100 milligrams sertraline, too much? No, usually 200 is the better dose. Tap the screen. Yes, exactly. Tap the screen. Double tap it. Double tap. It's like when you kill a zombie. You always got to double tap it. What are some medications that could be used stabilized for someone coming off meds? I assume, yeah, like illicit substances, right? So naltrexone is a good one, but oftentimes you just have to go through the withdrawal. Unless it's alcohol, that way, in this case, that can be dangerous. Can BPD heal? Yeah, you have to use DBT. It takes work. Oh wow, we're at 91K likes and the phone's at 20%. So let's see if we can ride it out. Which meds help prevent falls in elderly? I mean, there's not meds that can help prevent falls. It's more like, making sure they're oriented, making sure they're not dehydrated. But you don't want to have meds that worsen falls, aka anticholinergics. I'm on Strattera, 50 milligrams. Yeah, usually 100 milligrams is a good dose for Strattera. I mean, it's like one of the higher doses, but I find that Strattera is a work-based or it's a weight-based thing, so oftentimes people are underdiagnosing it. Let's get to 100K, yes. So also type 1 if you're a provider here, type 2 if you're a patient, and then type 3 if you are just an everyday person. So I'm curious what our distribution is right now. So we're at 193 people. And if you're 1, what kind of provider you are. Whether you're a PMHNP or a PA or an MD or a psychologist or something else. 3, 2s, psych NPs, NPs, PMHNP, nice. 1, therapist, okay. PMHNP student, nice. 1, counselor, okay, nice. Patient, 2, PMHNP, nice, welcome. Strattera versus Quellbri. Strattera I like to start with, but then Quellbri if Strattera didn't work, just because Strattera is way cheaper. Nice, we got a good mix here. We got some of everybody, and we're at 94K likes too. Awesome. Wife went, yeah, okay, we have a good mix, and we've talked about some good topics as well too. Wife had hallucination and psychosis, went to ER. Patient and criminal lawyer. Ooh, damn, remind me never to argue with you. On venlafaxine, 225 milligrams. How do I stop constantly sweating? Venlafaxine can do that. You can use stuff like clonidine to help with the sweating. You can also just decrease the dose. The reason that happens, venlafaxine causing sweating, is because it's the norepinephrine activity that's happening, so that's the danger about it. So it's kind of like your fight or flight system is too activated. So I recently just had a patient. He was on Wellbutrin and duloxetine, and he's sweating a lot in the morning. So I reduced his duloxetine from 60 to 40 milligrams because I want to reduce the amount of sweating he has. Why won't my body get stuck at a fight or flight? I mean, that could be a trauma thing or something. Does Lexapro really help with OCD? Yeah, it can, but you have to be on a high dose of it, like 30 milligrams. Excuse me, sorry. Can you take Benadryl for sleep when on lorazepam, Cymbalta, Latuda? You can. Benadryl's not a good sleep one. It's just too anticholinergic. It can cause grogginess. It's easy to get addicted to. If I take Vraylar meds in the morning, can I drink a little red wine at night? Yeah, it's not going to kill you. Wow, we're at 96K likes. Let's see if we can get to 100. I've never been through anything traumatic. My life has been perfect. So that's where a psych eval can be really helpful, because it's hard to just say what's going on without doing a full assessment and evaluation. And so if you want to get an assessment, evaluation, or a second opinion, one best ways to do that is to send me a message. especially if you want to work with me, and we can see if we're a good fit to work together. I'm on Monjaro. Hey, Jessica, good to see you. I'm on Monjaro, but Effexor and Seroquel to sleep. Are these meds going to slow weight loss? Seroquel might slow the weight loss a bit. Effexor, maybe not really. 98, well, we're at 98.4. Holy crap, we are vibing here. What do you think of melatonin for sleep? It's good short term, but long term, it can cause tolerance issues. SSRI effects on PCOS. SSRIs are used commonly to help with some of the symptoms of PCOS, but really, you'd use a lot of OCPs to help with that. What do you think of melatonin for sleep? Yeah, I already answered that one. Does Trintellix increase anxiety? It's supposed to help anxiety, not... I found it's been helpful for anxiety because it targets the serotonin receptors in more detail. So, wow, okay, we have just reached 100K likes. Holy crap. Jesus Louise. Wow, we did it. Squad up. Squad up. Let's go. So, okay, awesome. I think now is definitely, I think now is a good time to call. We've been live for 2.5 hours. That's crazy. So yeah, congrats. We're all working together to accomplish this. But yeah, I hope that this has been helpful. Phone's at 15% now, so perfect timing. Yeah, if you are a PMHNP and you want to really learn psychiatry in depth and you want to learn from me, best way to do that is to check out our coaching program. It's in my bio, or send me a message. And if you're a patient and you want to work with me, best way to do that is to send me a message as well. Or you can check it out in my bio. Otherwise, I hope that this has been helpful. How many milligrams of magnesium should I take for sleep? Probably like 200 to 400. Just signed up to level up. Let's freaking go. Let's freaking go. Okay, actually, I wonder who our 150th member is going to be. So we have 149 members. I'm curious who our 150th is going to be. So, yeah. Hope that all of this has been helpful. And yeah, I shall see you soon.